Hey, physical therapists. What we're going to go over today is how Mobile Medicare Part B actually works when it comes from the start, getting the referral in, to the discharge, who qualifies, who can do it, how does everything work from start to finish. That's what we're going to go over today. Okay, Mobile Medicare Part B. It's as it sounds. Medicare Part B is outpatient therapy. You can do that in patients' homes. Typically, you see it in a clinic, skilled living facility, etc. But it can be done in the home. Okay, you've maybe heard of home health care agencies, and that goes through Medicare Part A. But Mobile Medicare Part B is outpatient therapy that can be done in the patient's house. Patients do not need to be homebound. They can, but they don't have to be. Services are done in the home. You can bring equipment if you want. You can go outside, you can walk them, you can work on their golf swing, bring a table with you, work on some manual therapy. Whatever it is, you have autonomy when it comes to billing and what code you're picking and the services that you provide for the patient. Okay. Who qualifies? Anyone can get outpatient therapy. PTDU, we only work with Medicare patients because that's truthfully the only insurance that pays well enough to do one-to-one care. You can do private pay, obviously, but typically it's patients who are Medicare Part B or private pay, at least when it comes to PTDU. What types of patients am I seeing on a daily basis? Typically, it's your gait instability, stroke, post-op knee replacement, hip replacement, back surgery, falls, femur ORIFs. Typically it's the Medicare crowd, so it's 65 and up, and most of them have fall risk issues. They have gait instability issues. They have walkers or canes that aren't fitted properly. So that's typically my crowd, but there are therapists that we have here too who niche down into pelvic floor, into Parkinson's, so you can target your niche, or like I said, you can just work with whoever it is that you want to work with, pending they have Medicare Part B and they want to be seen in the home by you. How many visits can I do? Their cap allows for about 28 visits, which equates to a dollar amount of therapy per year. And that's of PT and 28 a year of OT. Okay, they have separate quotas for both physical therapy and occupational therapy, which I say roughly is 28 visits each. Okay, I'll have patients that I'll see earlier in the year. We're doing twice a week for 6 to 8 weeks. I'll have snowbirds that come down to Florida here, and they'll say, hey, Adam, I'm here for a month. Can we do 3 times a week for 4 weeks? Yes, you can. You have the ability, based on how much of their insurance quota they have left for the year, to see them. Typically what we end up doing is, like I said, that first episode earlier in the year, and we'll mark them down, and then we'll call them back for you later in the year. Say, hey, they got 12 visits left. Okay, so maybe I'm doing twice a week for 6 weeks, or 3 times a week for 4 weeks. So you're going based off, 1, what the patient needs, 2, how many visits they have left for the year, and then 3, what you guys agree upon pending, they're in town and they're able to let you come see them for a certain amount of weeks. What type of paperwork do I have to complete? Common question. There are no Oasis visits in Mobile Medicare Part B. So take a sigh of relief, take a breath. Everything's okay. All right, you're just doing evals, your treatment visits, progress visit, and discharges. Super simple, okay? Everything's done on the EMR. Everything clicks through, carries forward. We use what's called Clinician or Insight Go. Evals take about 15 minutes once you're proficient at it. Treatment notes take about 5. So it's a breeze. I'm a therapist. I do all this own stuff too. So that's the EMR system that we use and all of our therapists use here at PTDU. Super simple, and that's why I love using it. All right. When it comes to how does the whole process work, from referral to seeing the patient to discharge, and how do we even go from getting it back? All right. So let's say you have a patient in your community. They say, hey, John, I want to come see you for physical therapy. Great. All right. Well, we need their demographics. We need the name, date of birth, cell, address, a diagnosis, their MD name, and their insurance information, their Medicare number. Okay. Then we fax out an order request to the doctor. Doctors have to sign your PT order request. They send it back. Once you have the signed referral, okay, then you can process the insurance verification, process their Medicare, see how much of their insurance they've used for the year, verify their secondary insurance. Once you have all that, you can then go out and see the patient. So that's where you call the patient up, say, hey, Mary, we got your referral signed back. You got about 28 visits left for the year. when would be a good day for me to come and do your initial evaluation? Right? You have 30 days from the time that the referral is signed to see the patient. Otherwise, then you have to get a new referral if you go past that 30-day window. Okay, it's not like home health where you only have about 48 hours to get out there. In Mobile Medicare Part B, you have 30 days to schedule the eval. So that's where if you call the patient and you're busy the first week or two, great. Just tell them, hey, I can't get to you for 2 weeks. Let's set up for the third week and I'll come out to see you. Great. And you guys are set up good to go. When you go out to the patient, you have them sign consent forms, you get pictures of their insurance card if you don't already have them. All right. You do your evaluation, document it all, and then typically I'm getting them started on some exercises and giving them an initial HEP. For your evals, your 60-minute evals, you're going to bill your initial evaluation code and then 2 treatment codes. So I usually do a patient education code and then a Therex code where I'm getting started on their exercises. Okay, that's the start. I send in the frequency, say, hey, I'm going to do twice a week for 8 weeks. Plot the visits out, twice a week for 8 weeks. By the 10th visit, you have to do a progress visit. So you're just going to treat them down the line twice a week for 8 weeks. When that 10th or maybe a visit or two before, you're going to do a progress report. It's not a reevaluation. It's just a progress report where you're addressing the goals, talking about how much progress they made in their assessment summary. You're not billing anything different. You're just going to bill 4 standard, treatment units if you're there 54 to 67 minutes, and then be on your way. And then at the end of that twice a week for 8 weeks, you can either do a discharge, or if they still need therapy, they still need care, you can do a reevaluation and then write an extended frequency for whatever you guys agree upon, pending obviously they have visits left and they're not over their cap. That's start to finish. Pretty simple, pretty easy. There's no oasis. There's no panicking. If you have a missed visit, it just saves it, and then you can use it later in the year. Or if nothing's getting billed, nothing is counting against them. So missed visits don't hurt you. But that's basically it. It's a walk in the park, Mobile Medicare Part B. You get your own patients. You have your own book of people, and you treat them kind of at your ease, at their leisure. And you start building up a name for yourself in the community.